So one of the terms that you hear frequently in relation to quality systems is that of continuous or continual improvement. And I'm going to explain a little bit about what that means and some of the standard ways of improving your quality of both your products and services. The simplest and most logical methodology that's been adopted by hundreds of thousands of organizations is called the PDCA Cycle, and that means plan, do, check, act. Four very simple words that if you adopt them and you think about them as you introduce products and services, you will improve and continually improve the quality of your systems and indeed your products and services. So I'll just talk very briefly about what each of those words mean. In terms of plan, if you think about introducing a new service to your pharmacy, you're going to want to go through a planning phase whereby you think about what exactly you want to deliver, when you're going to deliver it, who is going to deliver it. Do you need ancillary services? Do you need instruments? Do you need products? Do you need training for your staff? Do you need training for your patients, indeed? And how are you going to make all of that happen on the date that you want to introduce the service? That's what we mean by the plan phase. Unfortunately, a lot of people, when they introduce new products or services, they simply jump feet first and they go straight into act. We'll throw it in, see how it goes. That actually doesn't work. So we encourage people to spend plenty of time thinking about planning before they get into their doing phase. Once you're satisfied that you've thought about all of the requirements for your new product or service, the next stage is to actually implement it. And you'll have a little project plan which says, I need to train people, I need to introduce equipment, might need to do some marketing, etc., etc. And you'll do all of that, and that will be part of the doing or the implementation. The next phase is one that a lot of people forget, and that is the check phase. The check basically says, have I done what I set out to do? Do I have some measures that prove to me that I've done it? And this is evidence-based. It's not kind of a notional, I think that went okay. It's I've checked with my patients, I've checked with my customers, I've checked with my staff, and I've checked with whatever guidelines or standards are available to help me to ensure that this is as good as it can be. Generally, you'll find on the first way through introducing a new product or service that there are actually some things, loose ends that you hadn't foreseen, and you're going to need to do something about those. That brings us on to the fourth stage, which is act. And act is taking care of some of these loose ends, correcting things as you find them, and ensuring that you actually meet that original expectation. Having done that, you will have some items in your act phase that require a bit more work than a small change. Therefore, you go right back around the cycle to the plan and you carefully go through a planning exercise again before you introduce the improvement. That, in simple terms, is what we call continuous improvements. There are other continuous improvement methodologies, such as the Six Sigma methodology. It's a bit more complex, but in fact, it follows exactly the same routine. It's plan, do, check, act. And if you can incorporate that into your daily activities, your daily routines, and any improvement cycles that you're involved in, you will be in the space of continual improvement. And that has to be an ambition for everybody who's interested in improving patient safety and services.